On va vous amener de l'eau.
Madame la mairesse Valérie Plante.
Madam Mayor Valérie Plante is going to be speaking, followed by Dr. Mylène Drouin, and then Ms. Chaborneau of the SPVM. Thank you. So hello to everyone and to those who are watching us through Facebook Live, and as well the journalists who will be asking us questions after. Of course, I want to salute my colleagues today, Dr. Drouin, the Regional Director of Public Health, as well as Ms. Carbonneau of the SPVM, the Montreal Police Force. There's a few elements that we wish to let you know about today. It's a lot of, bringing back certain messages, giving an overview, and it's true that we're often repeating ourselves, but it's important to do so because we know that many of these recommendations that are put forward by public health since the beginning, they can save lives. So this afternoon, in fact, we just met for the Municipal Council of the City of Montreal, essentially over the phone, but in order to reiterate and to renew the state of emergency for a longer period. It's important to ask the Municipal Council on a regular basis, and of course this is what will allow us to go forward. What was put forward last week concerning the measures for the homeless has shown quite well the importance for the City of Montreal with all of its partners to be able to act quickly and concretely. And the state of emergency, I'm reminding you, gives us the flexibility and agility to be able to respond efficiently. I would like to remind everyone, all Montrealers, a few rules for public health, and without an exception, please keep 2 meters away from anybody else unless you're a family nucleus. Avoid any non-essential moving around, and we're going to talk about this more this afternoon. And to respect, or at least to remain in your neighborhood, we really wish to limit any moving around that is not necessary and far from home. So, the walk that you like to take it in your neighborhood. When you go shopping, go shop in your neighborhood. If you need a prescription, go in your neighborhood. This is not the time to start visiting the city, the different parks. Please stay in your area. Speaking of taking the air while respecting the rules, yesterday I spoke to you about the possible closure of the parks in the city of Montreal. A lot of people wrote to us begging us to not close them. And as you know, for us it would be a last resort, which we really do not wish to get to. This being said, in order to send a very clear message to say that inside the parks, not only does the social distancing of 2 meters be respected, but especially there are activities which, if they are not essential, don't go in the parks to do so. Walking around to get some fresh air, yes, but drinking, no. Jogging as a group, no, it's not the time to do so. So to help us send a very clear message to the users of the parks, we have asked the police force of the City of Montreal to help us out. Already the presence of the police has been increased in 6 great parks of the city: the Montreal Park, Jeanne-Mance Park, Laurier Park, La Fontaine Park, Maisonneuve Park, and finally the La Chine Canal. Those parks, as you can see, are large parks, but they are in very dense neighborhoods where there's a lot of people, and we understand why they're so popular. That being said, we ask you to please respect the rules. The police will not hesitate, if necessary, to give you an offense report, and which could force you to pay up to $1,000 if the rules are not respected. So we do hope that things are going to go well. We are going to have a look at things every day, and we wish that this Sunday we will be able to keep the parks open. I told you that the police is present in the big parks, but it's also going to be in local parks as well. But I just wanted to mention that in the big parks, well, where we've seen that there's a lot of crowds, there will be increased police presence. And then finally, what I wish to tell you, yes, good news today. What we wanted to tell you is that we heard the health workers tell us we would like to have more flexibility for parking. So we worked with our different partners, and now we'll be able to show you there's going to be a vignette, a sticker that is available. It will be the COVID-19 sticker, and it's really the City of Montreal that is going to give 150 parking spots to be able to park close to your place of work, to all the people who have to keep working. So this is work that was done together with the City of Montreal, and the stickers are going to be distributed through the CHUM and the Jewish General Hospital. I would like to mention that other partners are also making an effort and are participating to these considerable efforts of our health professionals. The Palais des Congrès, the Congress Center, is also going to offer their parking lot for the staff in the healthcare sector, and it's a way for us to thank everyone who is doing colossal, incredible work. We know how devoted they are, and we thank them, so they will be able to freely park. The last element is the BIXI. I confirmed that the BIXIs will be able to be used as of the 15th of April, and that in compliance with the public health guidelines. I'd like to remind you that the BIXI can be an efficient way for different people to be able to get around, for example, to go work. I bring it back to the essential elements. So going out essentially, going to work because you have to, going to the pharmacy because you have to, it's essential. The BIXI will be able to be used for workers in the health network, for example, who rather than taking the metro or the bus will be able to take a BIXI. You will understand that the hygiene measures will be increased. There will be guidelines posted, and the BIXIs will be cleaned on a daily basis to ensure that they are clean. Once again, don't take a BIXI to go bike around the city. It is to be used if you need it for events or at the very least essential activities. So, to end with, big thanks to all Montrealers who are doing exceptional work. I wish to remind you all that when I say exceptional work is that I know that you're showing a lot of resilience. I know it's not easy on a daily basis, but this is how we're going to succeed going through this all. And of course, everyone, with no exception, has to comply with the rules put forward by the national and regional public health so that we can get through this as quickly as possible.
So this afternoon, we're together to share a few elements and to remind everybody about some of the recommendations that are essential for us to go through as fast as possible. So first of the things I want to remind everybody is to keep your distance. We're talking about 2 meters. To avoid non-essential travel. And this is something we want to put a lot of emphasis on today. If you, the non-official part is crucial if you want to succeed in this. If you have to go outside to take a bit of fresh air, it's fine, but it's not time to go outside and discover the city, whatever it's on your bike or walking. And we ask everybody to stay in their neighborhood. Go to the grocery store in your neighborhood. Go to the pharmacy in your neighborhood. It is very important to contain as much as possible the spread of the virus. And speaking of taking a bit of air, I've said it yesterday that we do not want to close down all the parks. For a lot of Montrealers, this is their only way to enjoy a little bit of green, a little bit of space. A lot of people don't have a backyard or even a balcony. So it is important for us to keep them open, but everybody needs to follow the rules. And the 2 meters is very, very important. If you see that a place seems to be crowded, don't go there. But of course, though the majority is following those rules, we see that a very limited of a minority of people are not. And so this is why we've asked the SPVM to help us make the message clear. And so there will be a stronger presence of police officers in 6 of the biggest and most popular parks in Montreal, the Mont-Royal, le parc Jeanne-Mance, which is just beside the Mont-Royal, le parc Laurier, le parc La Fontaine, le parc Maisonneuve, and the Lachine Canal. Those parks are also very popular because they're big and beautiful, but also because they're in very dense areas. So it is very important for everybody to respect the rules, and police officers will be there to make sure that everybody understands. Of course, we also always having a conversation and raising awareness is always what the SPVM puts forward first, but if necessary, there could be a ticket sent to given to those people. So because we want to make sure that we can go through this crisis, and again, it's not a sprint, it's a marathon, I'm really hoping that everybody will follow the recommendation and so we can keep our parks open. That's very important to us. A new element today, we just presented the new stickers that will be available for the for healthcare workers. Those people that are amazing people doing an incredible job, that are working at the CHUM and the Jewish General Hospital will be distributed some of those stickers so they can park for free. So I'm very glad the City of Montreal was able to move forward using some of the parking meters spaces for the healthcare employees. The Palais des Congrès is also supporting our healthcare angels, as we call them, by making their parking available for them. And of course, I want to thank all the healthcare personnel, everybody working within this system for making such an amazing work. Finally, talking about transportation, I want to confirm that the BIXIs will be available starting in April 15. Of course, we had the go coming from the public health. And I just want to remind everybody that if you're using a BIXI, it's for necessary movements. It is not to discover the city or to bike around. That is not what it's for. But I think it is a great option for some of the people that usually might be taking the subway or the bus to go and work somewhere, maybe in the healthcare system, so they can use the BIXI. We've raised the different rules around using the BIXIs. There will be information on how to use it, and we will clean them, of course, more repeatedly to make sure that they are safe. So before ending, I just want to thank everybody, all Montrealers, for their resilience. I want to tell them that we're working really hard, and I think those press conferences with the SPVM and the Public Health Authority shows how important it is for us to make sure that we're going through this as quick as possible, but also to keep our Montrealers healthy and to continue. I was about to say a normal life, but I think it's everything but normal right now, but at least that we can continue to have some of the spaces that are so precious to all of us. So thank you so much for your intention. And now?
Drouin de la Direction régionale de la santé publique.
Dr. Drouin. Hello to everyone. So today I will allow myself to be a little bit more directive. I have given guidelines and advice in the course of the past few weeks. Montreal is the epicenter of the pandemic. The number of cases has progressed significantly in the past 24 hours. We're at 2,642 cases, 17 deaths, 149 hospitalization, and 39 people in intensive care. That represents exactly 480 new cases in the past 24 hours. It's 148 healthcare workers and over 20 outbreaks in our CHSLDs and elderly homes for the elderly. You understand that we are in the ascending curve of the pandemic. We said it. Geographically speaking, certain sectors are more affected than others. However, when we look at community transmission, all of our boroughs, or almost all of them, are knowing important growth, and we consider that the transmission is sustained everywhere. That is why I want to repeat that the measures that we must take are for all Montrealers. We're not going to confine any one borough or neighborhood that's not efficient. For now, we're not going to be closing down the bridges or putting restriction on them. That is not what is going to transmit the community transmission right now. Today, we consider an estimate that we are probably in the next few days, where there's going to be the most people infected that are moving around in the community. And it is important to know this. And it is for that reason that it is so primordial today. Each gesture counts. When we're talking about limiting moving around, it is limiting them to essential things. Doing groceries, buying medication, essential workers, obviously, your medical meetings or appointments, and if you are a caregiver. And I repeat, you don't have to go to the grocery store every day, getting one day, get some milk, and the next day getting your beer, and the next day toilet paper. Plan things out, go only once. In doing so, you protect yourself and you protect essential workers as well, and you make it that we reduce the contacts that they have with the population, and everybody is potentially infected. So the outside activities, we talked about it, jogging, walking, biking, we wish to keep allowing these. We believe that the risk, that the virus is not going to jump out at us if we respect the 2-meter distance. But please make it that we do not recreate gatherings in parks. We've heard in the past few days that there's still gatherings being done in parks, and if we have to close down the parks, it would be very unfortunate, because we would make it that most Montrealers who do listen to the guidelines would be deprived of them. But at this stage, we can no longer accept any delinquency with these guidelines that we are giving the population. So it really is today that the virus is in circulation with the greatest intensity. And if we do not do things correctly right now, the pandemic is going to be with a much broader scope and amplitude and lengthier. That's specifically for the Greater Montreal area. These are gestures that require concessions. These are gestures that save lives. It can appear to be very abstract, but collectively, this is what will allow us to come back to normalcy more quickly. Also, the government announced today new criteria for screening, the priorities. In a context where we have increased our screening capacity, it remains that we must prioritize people for whom it is essential that they be screened. Of course, hospitalized patients, healthcare workers, because we wish to protect them, CHSLDs, residences for the elderly, shelters where we know that there are outbreak potentials, and our essential workers. For Montreal, we will still keep priorities, and a capacity to screen within the community is going to be targeted to certain groups and certain places for which we think that there might be risks of outbreaks and where we want to control these outbreaks. And as soon as we have more screening capacity, please know that we will broaden it to the population at large. That means that for people who have symptoms, regardless whether you have light symptoms, and regardless whether you have succeeded or not in having a diagnosis through a lab, you must remain isolated at home for 14 days. Do not go contaminate your friends, by having a drink at the park. Do not go contaminate essential workers by going to the grocery store, and protect those most vulnerable, who are elderly and people with chronic diseases. And as of tomorrow, we are going to launch a website, an app in which people who will be developing symptoms will be able to self-declare. And that will be one more tool for Montreal that will allow us to follow the outbreak throughout the island. So as of tomorrow, we'll be able to announce to you how to register on that site if you develop symptoms. Thank you. Just like the mayor, of course, we want to support the mayor to be able to keep the parks open, because it's very important. So as of now at the SPVM, we will intensify the measures to ensure the respect of the guidelines, whether they be gatherings inside or outside. For the past couple of weeks, we've done a lot of awareness raising. It is fruitful in most cases. In other cases, it's more difficult, particularly in parks. So we really want to make sure that we have accrued presence. We have set up teams that will be able to intensify that presence in the main parks to create awareness a little bit at the entrance to the parks, but we are now going to have to act much more strictly if we wish to keep our parks open. We've had a lot of calls at the SPVM, people calling to report that there are people not respecting the guidelines. So we want to make sure that this be done. So what we'll do as of now, we're announcing that the sanction for any non-respect of the orders will now be privileged without any other further notice. So yes, we are going to create a bit of awareness, but we have to act. So consequently, as soon as police officers will see that there are citizens who contravene to the orders of the public health, they will no longer remind people of the guidelines. They will proceed directly to the identification of the people in order to write a general offense report. These reports will be submitted to the DPCP for follow-up. Of course, as we mentioned, we wish to keep the parks open, so we are keeping an eye on that. We really want to involve ourselves. We want to help the mayor to keep our parks open, so we're going to put a lot of emphasis on that in the next few days. And the weeks to come, I am convinced, they're saying it's going to be very beautiful over the weekend. Today it's raining, but over the weekend it should be beautiful. We know that the parks are going to be very busy again, so we're going to be very present in the parks. And what I must add as well is that the sanctions are going to be from $1,000 to $6,000. Nobody wants to have an infraction of $1,000 or $6,000 in the present context, but we're now at that stage and we'll have to proceed in consequence. So we're there to support everything that is being done at the city level and at the regional level, and we really want to help the mayor keep our parks open. I want to let you know that we're going to go to the question period for all interveners, and then the mayor is going to make a declaration on the incident that took place yesterday with the chief of the opposition. So if there are questions on that, that will be at the end, please, once the others have left.
No,
we are in the epidemic curve that we were expecting. So no, we have not lost control. I would tell you that in the past few days, we haven't doubled the number of new cases per day. However, we're still in the ascending curve. And when we look at our estimates to look at where we get to the peak, and 10 days after that, it will be the peak of hospitalizations, because it often takes a week to 10 days after the beginning of symptoms for people to have symptoms that are more serious. So we realize that we really are in the ascending curve, and that means that right now the virus is probably at its full potential, circulating throughout the community. That's what this means. So we're not losing control. I think the measures that we have taken are the correct ones, and we took them the 23rd. That was the lockdown, which is certainly one of the most efficient measures. And all of these measures taken together, but now if the population does not respect all of those measures, that is where we may have cases where the virus might find cracks in the system and where we may lose control. But with the group of homeless people, we set up solutions to try to really constrain things. You know, the homes for the elderly, we're doing it as well. Everything that, you know, the multiplexes yesterday announced a strategy. So these are places where we know that the risk is higher for spread. But what we're asking is that the population in general, please comply with the rules, because that will help us globally to be able to take care of the other outbreaks. In light of everything, why don't you close either the parks or bridges? Partly an audible question. Something about people coming by bridge, going to the parks. As I said, when we are in presence of community transmission, to put a sanitary cordon in the strategies for isolating populations, there are different measures of distancing that we can do, and we do it gradually. And the sanitary cordon is really to isolate a region where there's low transmission, or very, very low or no transmission, to a region where there is. In Montreal, and even in the greater Montreal area, if we have control, extra extra control measures were going to have to include Laval, the South Shore, the South area of La Naudière, and the confinement. The strategy that the government took is to take it peripherically to protect those regions that are further away, and that's the right strategy. Right now, having a sanitary cordon, well, we can reduce moving around and staying in a neighborhood, but confining Notre-Dame-de-Grâce away from a Hunsick or another neighborhood, that is just not an efficient strategy in the context where there is transmission that is very well installed anyway. So journalists who are here, please use the microphone so that you can be heard on Facebook Live. Yes, Dr. Drouin, I would like to know, concerning the healthcare staff, you gave a number. Yes, 148 healthcare workers who have been infected in different ways. In some cases, they were infected a long time ago, so it was through travels, but others either in the context of their work or through contact with other people. Apart from the travelers, amongst these, are there mainly people who were contaminating in a CHSLD or homes for the elderly? I'd have to look. I don't have the numbers with me right now, but we have not found out the place of contamination. We'd have to make a specific extraction for that. For the screening test, yesterday, Dr. Drouin, you mentioned that there was a problem with the labs, and that is what was slowing down, and we had to expect an important increase in the number of cases. Yes, that's what we're seeing as well. In the course of the past few days, but I think that by tomorrow probably, the labs had what they call a backlog. So in Quebec, I think we had over 13,000 or 15,000 which had not been fully analyzed, and we were told 13 to 15,000 tests? Yes, that had not yet been analyzed. So we were told that in the course of the next few days, so probably it should be over by tomorrow, that all of that, they were going to succeed coming back to a state of normalcy. But I think it's around 7,000 lab tests per day is the capacity. And the idea of emitting priorities is really, of course, to protect the healthcare workers, the essential workers, and controlling our outbreaks in the different residential facilities where we know that there are people who might have a higher risk of dying, might need more intensive care. So that's where we're going to put our energies with the capacity that we have. But with the residual capacity, the directors of public health of different regions will have the discretionary choice of determining which group might be screened first as a priority. And we will do it as well to try to control outbreaks in riskier areas or groups in Montreal. So that is what we are working on right now. And as soon as we have a much greater screening capacity, for sure we will broaden the scope to more people in the Montreal area. So that screening capacity, is it linked to a problem with equipment or staff? Because it was mentioned quite a bit in a few social networks. I think it's more the equipment right now. Okay, so a lack of reagents? Yes, that's the problem. Well, from what I know, I mean, it's not my file personally, but I've been told that it is an issue. A question scientific, and I know that I'm going in a field that I don't know at all, but Spiridine. Oh, well, I don't know anything about that either. I could refer you perhaps to somebody. Well, it would seem that some experts are having a close look at that, and it could act. It's not a miracle, of course, but it could act on the receptors of certain cells. Well, I've seen a few studies on other medication, but not that one. It's not a medication, it's a natural way. Apparently it is found, for example, in citrus fruit. So a good glass of orange juice, I don't know. Oh, okay, well, I'm thinking, oh, well, I drink orange juice every morning, yay. Will you be able to get back to us on that? Yes, I'll have a look at it with my team. The Hasidic Jewish community of Outremont has many cases of COVID-19. Are there any specific measures that have been taken to help them and to have the confinement be respected?
Évidemment,
Well, obviously, when we conduct investigations and we get a case, we don't ask anybody's religion. So for us, it's pretty difficult. I mean, it's more territorial approaches that sometimes allow us to see that perhaps there is something being transmitted within a community. We have already had many approaches with the Jewish community, with the doctors of that community as well, to make sure that the guidelines are being respected, and also to make sure that there is good collaboration. So those are almost daily contacts that we have with the community or members of the community. So for the time being, I mean, we're working on that with them in the same way that we work with any other community for which there may be issues. And of course, the rules are applicable for everyone in the same way. There's a pandemic and we have to protect the population as a whole. We do it for ourselves and for our families, but also for the community. So obviously with public health, but also with the police forces, if necessary, we intervene when individuals, sorry, I'm looking for my verb, do not comply. Thank you, Dr. Drouin. Do not comply with the rules. I think it's important to know, and I've repeated it often, that we really work in collaboration with many spiritual leaders who are helping us with that. But in the end, as I was saying, the rules are applicable in the same way to everyone, regardless of the situation. We must protect all the population. Everybody must make efforts, and it's the same rules for everyone. Many festivals don't know what to do anymore. Is the city going to cancel any festivities until the 30th of June, as Toronto did? Thank you for the question. We are speaking right now. Already the events of the month of May have been cancelled for obvious reasons. And for the rest of the summer, we are speaking with all of our partners, and we should be able to let you know very briefly. But of course, there is no question of risking the public's health. And as we often say it, when we say that this is a marathon, we can see that we are going to be here for the long haul. An explosion of cases in people 80 and over, how can it be explained that it went up by 40% in one day? I don't have the numbers for Montreal, but for us, the cases remain. I mean, of course, we have, yesterday was 40% above 50 years and over, but the majority of cases in Montreal, we still had a very important proportion in the younger population. Of course, when we see an explosion in that age group, right away we have to think about the outbreaks in places like CHSLDs and residences for seniors, and the deaths are a lot in the 80 and over and even 90 and over. So that means that what reflects that explosion is the outbreaks that are going on in certain facilities where there's a larger concentration of very elderly people. The National Institute of Public Health of Quebec recommends using hydro or gel in buses and metros. Is this something that is being set up? Definitely, this is a discussion that we're having right now with the STM, and we are going toward that solution. Thank you. What health institution has the worst outbreak? I think Dr. Horatio Arruda said so. The responsibility of naming, and there's a lot of health institutions that have outbreaks, we're not going to start making a list of all health institutions that have an outbreak. Each institution, each CHSLD has the responsibility of communicating it to the population and the families that are concerned. Of course, we've heard it in the media. The greatest explosion in Montreal is that in the north, in Notre-Dame-de-la-Merci, clearly. It started already last week, but as I'm telling you, it could be completely different within a few days, and we are clearly not going to every day put the name of the patients, the workers first, because it's very difficult to keep an updated list. Things move very quickly, but also what is important isn't so much the public interest, but it is the people who live and work in those places and the families. They're the ones who need and have a right to know, and it is up to the institutions to transmit that information. So I'm not going to be putting that on the web. I'm telling you that today. Along the same vein of the elderly in Montreal, there's a lot of tens of big buildings with a lot of elderly people who live there. And yes, we started working with the municipal offices. Okay, but for the time being, the comings and goings, people can come in and out. There's no measure taken. Well, yes, right now in the strategy that I announced yesterday with the multiplexes, the buildings where there's a lot of elderly, those are the first ones with whom we really are having a more intense intervention. Of course, it is going to be to enforce the hygiene measures and, of course, restrain access to those buildings to avoid visitors. And already we have a certain number of buildings in which there are confirmed cases, and the people in those buildings will be advised that there are cases in the building and that they must be more vigilant. More vigilant, that means that if you have a chronic disease and you live in one of these buildings where you are immunosuppressed, you should be even more isolated beyond being just, 70 or over. You have to isolate yourself if you have a chronic disease. It's an accumulation of risks. So we know in Montreal there's a lot of big buildings, multiplexes, and it's a factor of risk and density of the population, which has an influence on the transmission of the virus as well. So we're going to be very vigilant, and we've already started working on that file with our partners. How many cases can you identify? I don't know how many cases, but I do know that we already have 5 buildings that we'll be targeting for quick intervention. English questions?
Non, mais c'est parce que je vais libérer les gens. Dr. Drouin, you say Montreal is the epicenter. You are the city's top public health official. From a purely health perspective, can you explain how allowing a citywide bike sharing service like BIXIs to operate during a pandemic is good health policy?
Like we've said, the using of BIXI is like we see it for some person as an essential service, and we think that it is better to use BIXI than to use the subway. So it is better. It is an alternative that is that we encourage. If you touch the BIXI and if you touch the pole in the subway, you have to wash your hands. Do not put your hands in your face, and it's quite the same recommendation. But we think that biking in the city to go to work, if you're an essential worker, it is a good thing. So with the recommendation to increase the level of hygiene, I think we're not increasing the risk. But at the same time, we're saying to the population, don't take the BIXI for a bike ride on the Canal La Chine or in Montreal. It's not what we're saying. We're putting this in place, and we're recommending to keep BIXI in place because we think that it is a good alternative for those who have to travel to work.
And maybe we have to see it that the same way we ask people not to take a subway ride or a bus ride just for fun. You're not using BIXI just for fun. You're using it for a purpose to go from point A to point B for essential movements.
From Global News. Here's my question regarding the increased police presence in Parc La Fontaine this morning to monitor distance between citizens. Were any fines given out? Will police be monitoring all parks now too? So I think we just answered this.
As I said before, we will be there to monitor all the major parks. And for the small parks, our PDQ, Poste de Quartier, are going to be present in the smaller parks. Up to now, we haven't, I believe we gave 6 reports. We've written 6 reports, and they're going to be addressed by le directeur des poursuites civiles, criminelles et civiles.
Thank you. From CTV, we know one of the sources from the outbreak of cases at the Verdun Hospital was a doctor who was asymptomatic, making rounds on several floors. Is there anything else that can be done as procedure or policy to help stop this from happening, especially when it's a doctor that doesn't show symptoms? Should we be more regularly testing all health professionals for COVID-19?
But as you've seen, testing health professional is one of the priority that is it's one of the group that we are giving a priority. I don't have all the details on what happened at Verdun Hospital because, as you know, we have outbreaks in a couple of hospitals right now. But of course, we have to make sure that every essential worker and especially those working in the healthcare units, if you have any kind of symptoms, just don't go to work. That's the first thing. And of course, we're testing more and more people, but we're not testing like asymptomatic person. And the test is not reliable for asymptomatic person right now, the test that we have in Quebec.
Thank you. Last question from CTV. Addiction treatment centers are having to turn away new patients because of COVID-19. They're worried lives could be lost if people don't get help. Is there a plan in place to help people with addiction issues?
I don't have all I'll have to see with my teams. I know that what we are doing for les SCS, c'est quoi in English?
Mon Dieu, c'est injection.
The injection center. We've closed them for a couple of days to make sure that we are going to put good hygiene practices, but we're going to reopen one. But for dependency, I have to see what's going to be done by the team. It's not my team that's working on this, so I'll have to see, to refer to another person.
Merci beaucoup, Dr. Drouin et Madame Carbonneau.
Merci.
Beaucoup.
Thank you very much to everyone.
Presse. Merci. Parler de la situation.
Children, weddings, even funerals or births, moments of gathering around these events. So if it's not acceptable for the population as a whole, it is also unacceptable for elected officials. Right now, we're asking Montrealers to really put their lives on hold. So I'm asking myself the question, why should that also not be the case for elected officials, and particularly for the chief of the opposition? My message is that nobody is above the rules. As political personalities, people go towards us, they look to us and the elected officials, and the minimum that we should do is to respect the rules and give the example. I also wish to mention that Mr. Perez was present at the board meeting on the 23rd of March last week, where it seemed that his son has symptoms and did, in fact, test positive to COVID-19. This asks questions on the ethics and judgment of Mr. Perez. So what I ask is that Mr. Perez apologize to the Montreal population, and I would invite Ensemble Montréal, his party, to question itself on the best way of regaining the confidence of Montrealers now.
A few words in English. So I want to come back to this situation reported yesterday by the media concerning the behavior of the leader of the opposition, Monsieur Lionel Perez. He felt that it was appropriate to hold a gathering at his home despite public health instruction to the contrary. Regardless of the reason for the assembly, it is not acceptable in the context of the pandemic in which we find ourselves. A lot of Montrealers have been making a lot of sacrifices, not holding different types of gathering. Maybe it's about a new baby born, or maybe it's about an anniversary, or even for somebody who died. So everybody's putting their life on hold. So if we ask Montrealers to do that, I think these rules also apply to the leader of the opposition. No one is above the law. As politicians, people look to us to set the example. The least we can do is to follow the rules with our actions. Moreover, Monsieur Perez attended the municipal council meeting on March 23rd when he knew that his son had symptoms and who later tested positive for COVID-19. This raises questions about his ethics and judgment. So what I ask him to immediately apologize to the people of Montreal, and I invite Ensemble Montréal, his party, to ask itself what they can do to regain the trust of all Montrealers right now. Thank you.
Question?
Est-ce que M. Perez devrait démissionner?
Should Mr. Perez leave his functions as leader of the opposition? As I said, for the time being, I think that there must be apologies to let Montrealers know that it was a total lack of judgment, and it is not what we wish to encourage from the population at large. And as I said, I strongly invite the party Ensemble Montréal to think about how to regain the trust of the population. Madame Plante, taking into account that Mr. Perez was, as you mentioned, present at the municipal board on the 23rd of March last, and it is the very day where his son was going through a test and he already had symptoms, do you fear for the political staff of Mr. Perez, but also the elected officials who have been in the presence of the leader of the opposition, that there might be problems, including yourself? Well, listen, when we tried to have that meeting on the 23rd of March, of course, all the rules had already been set up. When we look in the camera, you can see that the social distancing was very large. There were very few elected members that had gone. It was essentially the parliamentary leaders, head of the opposition, myself, and the distancing was very great. But obviously, when we learned that information on the following Sunday, that concerned us quite a bit, because the responsibility that we have as individuals is that if we have information, you can't just put it aside. You have to act immediately, and if you have any doubt, you abstain yourself from coming to municipal council. So you learned it the 23rd, on Monday, the 23rd. So you learned of it last Sunday? Yes, it was communicated to the court clerk. If the staff, for example, the minister's office, Mr. Perez's office, he communicated with Mr. Derek, who communicated the information to us. And I believe that, I like to think that Mr. Perez had a conversation and took the necessary measures for his immediate staff. I didn't have any contact with him. Even when we're in the same room, we must have been at least 8 meters away. We were far away from one another. But I don't know for his close team. I don't know. Are you worried about this situation in particular? I think that more than anything, I'm shocked, like a lot of Montrealers, because people look at us and look to us, and I'm not somebody who says that, we have to be perfect as elected officials. But we are in a pandemic where we must absolutely every day examine ourselves and think, okay, is that walk that I wanted to take, is that store that I wanted to go to, is that essential? The fact that it's been many days that I've been stuck at home, I say me, but my kids are not that young, but those who are stuck at home with small children and who need to, breathe some fresh air and who take the responsibility, we all examine ourselves every day to know, okay, is that the right thing to do for the community? So for me to see the leader of the opposition of the city of Montreal, an elected official who twice did not have that judgment, that shocks me. Thank you.
Questions in English? Merci.
Thank you.
Bonne journée tout le monde.
Have a good day, everyone.